Can I get double eyelids without surgery?
It's generally understood that half the people of Asian ethnicity, including people of Chinese, Japanese, and Korean descent, are born without an eyelid crease, often referred to as a monolid. An eyelid crease, also called a double eyelid, is considered desirable by many because it makes the eyes appear more open and brighter. I'm frequently asked if an eyelid crease can be created without surgery. I'll explain how an eyelid crease occurs naturally and how I help my patients who are interested in having double eyelids. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been practicing for over 25 years in New York City and Long Island. I routinely perform all types of cosmetic eyelid surgeries, including different types of Asian double eyelid surgery. I also routinely perform non-surgical eyelid procedures, such as cosmetic fillers for hollow eyes. In addition, I perform laser and radiofrequency treatments to improve and tighten eyelid skin, as well as using PRP or platelet-rich plasma to improve eyelid skin rejuvenation. Looking more broadly at all ethnicities, it's clear that most non-Asian people have a natural eyelid fold. An eyelid fold is created naturally with fibers from the muscle that lifts the eyelid, called the levator muscle, like the word elevator without the letter E. This connects to the upper eyelid skin. Now, this area of the skin-to-muscle connection is where the eyelid skin folds, thereby creating a natural eyelid crease. People born without an eyelid crease don't have this type of skin-to-muscle connection. Some people can have multiple but shallow or undefined creases. Other people can have a crease that is sometimes visible and sometimes not. These are typical situations where there is a weak connection between the eyelid skin and the levator muscle. The key concept to understand is that these connections are internal between the skin and the muscle. Therefore, the only way to establish a connection where it doesn't exist or is weak is through surgery. Unfortunately, there is no non-surgical method to create a skin-to-muscle connection, such as an injectable filler or a neurotoxin. Although we can do a lot of things with lasers, the external application of a laser cannot create the necessary internal connection needed for double eyelid surgery. So what do I do in my practice? The procedure I recommend to my patients are based on specific anatomic and tissue quality factors. During consultation, I help my patients understand what a potential result can look like by lifting the eyelid skin with an instrument or a Q-tip to reveal how nature would likely have created a crease given a patient's unique anatomy. This also applies when there are multiple creases. A defined crease can be created with this same method. In general, for younger people with no redundant eyelid skin or prolapsed fat, sutures can be passed through small openings in the eyelid to create a skin-to-muscle connection, thereby forming a crease. This is a minimally invasive procedure called a non-incisional Asian double eyelid surgery, or non-incisional Asian blepharoplasty. For people with significant hooding over their eyes, often seen in people who are older, some of that redundant eyelid skin needs to be removed. The art is in determining the pattern of skin removal such that a natural double eyelid fold will be achieved. This is in contrast with non-Asian eyelid surgery, where a double fold after surgery is just not expected. Design and precise measurements are critical in Asian double eyelid surgery. The presence of prolapsed fat can also be addressed to avoid the fat from interfering with the skin-to-muscle sutures. skin and fat removal is part of what we call incisional Asian double eyelid surgery. I perform both non-incisional and incisional Asian double eyelid surgery for my patients with local anesthesia and light IV sedation. My patients routinely leave our office feeling good and go home to recover for a few days. This contrasts with the use of general anesthesia, which is associated with more risk and prolonged recovery. Our patients typically get back to work in a week after surgery with minimal swelling. Now, there are non-surgical ways people do use to create temporary eyelid creases. These include eyelid tape or eyelid glue, but these don't create long-lasting creases. And the use of adhesive on a thin eyelid skin can cause irritation and even damage your delicate eyelid skin, which is only 0.5 millimeter in thickness. Repeated eyelid manipulation can potentially cause the levator muscle to stretch, resulting in eyelid ptosis, where the eyelid actually droops. Eyelid ptosis surgery would be necessary if ptosis were to occur, adding more complexity and greater expense to Asian double eyelid surgery. In conclusion, creating a lasting and defined eyelid crease can really only be done with surgery. The combination of art and science in Asian double eyelid surgery cannot be overstated. In my opinion, the goal is to have a safe procedure with as predictable results as possible and a natural appearance as if you've always had a double eyelid fold. I hope this information from my experience helped you. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.